So I grew up in a very small town in central Missouri. There was only about 1,100 people in my town. I had a high school class of 36, so a very small place. Uh, was not really a decision. Everybody went to the University of Missouri because that was our home state, and we went to our home school. And so from there, did undergraduate degree in biochemistry. Stayed on at the University of Missouri, did both my medical school training as well as my residency in otolaryngology head and neck surgery. And so after spending 13 years in Columbia, Missouri, we migrated 200 miles north to Iowa City, and that's where I did my head and neck surgical oncology fellowship. And that's where I began my academic career. I was on a peds rotation, and then I decided I wanted to do otolaryngology head and neck surgery because we were taking care of a young kid with cystic fibrosis, and they had papillomatosis, and it was just a really complicated case. And so I really got intrigued with head and neck as a specialty. And then as you keep going through the process, you learn the things you do and don't like. And just taking care of head and neck cancer patients is so rewarding. Cancer care it needs to be multidisciplinary. So it needs to have lots of different people participating. And it's easy to kind of think of a way that the surgeon plays a role, the medical oncologist plays a role, the radiation oncologist plays the role. We really focus, though, on the therapies that we're directing to kill the cancer. If we only focus on that, though, we don't really do a great job of taking care of the patient, because there's lots of other things that go into this, and whether that's rehabilitation from physical limitations that come from the cancer therapy. In the head and neck area, we have lots of issues of how the treatment affects both speech and swallowing. So we have speech and swallowing specialists that see our patients throughout their therapy. Physical therapy plays a big role for all kinds of rehabilitation. And then even beyond that, spiritual health, nutrition, navigation, there's all kinds of people that are really important to help people navigate this journey. But there's no real way to say that one sex is less affected than the other. And it can really affect people from all ages. And so I've seen patients with mouth cancers as young as the age of 8, and we've treated patients well into their late 90s for similar problems. But realize that when you come to see us, that we're going to have a team of people that are going to look after you. We're going to take care of you. We're going to try to answer all your questions and meet all your needs. And it's not just one person you have to deal with, and it's I don't want to ask the doctor a question because I don't want to waste their time, because we have a whole host of people that are working together in unison to take care of all your needs, and everybody's here to answer questions and support you through your journey.